Yes, I'm from Alabama. I'm from Mobile. I had to sit myself up, y'all. Okay, so as you guys know, some of you guys, um, I definitely have had. Okay, I am from Mobile. I don't think you're too far from where we live now. Um, so let me give y'all an update. These titties is done. Ow! But yeah, so y'all, I wish, um, thank you. I wish I would have done this when I was younger. Thanks, honey. Because for the first time in like 10 years, I don't snore when I sleep anymore. Hey, honey. Hey, Redbird. I no longer snore at night because I don't have a lot of weight on my chest. They took about 5 to 6 pounds of weight off of my chest, y'all. And I'm healing well. They took about anywhere from 5.5 to 6 pounds of weight off of my chest. And that part does feel good, but I'm still dealing with like balance because when you have that amount of weight removed from your body, like your chest area, you do have balance issues. So like I'm able to stand up straight. My posture is great, but I'm still in a lot of pain. Um, I'm in a lot of pain. I take Percocet and then I alternate from like Percocet to 3 Tylenols and 3 Advil at one time. I think it is one of the best things I've ever done. One of the best decisions I've ever made. But hey, honey, y'all, I'm gonna go. I did record myself on this journey, but I don't know how I'm going to edit it or if I'm even going to put it up because it's just so personal. But I am going to do an in-depth video in like 3 parts. And the first video I'm probably going to do is probably going to be like on Sunday when I feel like I can really like get myself up and like put something on this face. Cause y'all, like, the pain is real. I looked at a lot of reviews. Yes, I have Instagram. It's the Bama Girl Cafe. Um, the pain, like, people did not. I looked at a lot of things on YouTube, and people just did not. I don't think people were really honest about the pain level, and I can take a lot of pain. I can take a lot of pain. Um, I've like I've been hit. I've had a couple 2 pieces in my life and got up like, bitch, what? But the level of pain, the level of uncomfortableness, the amount of sleep you have to take, the constipation. Oh, oh my God. The constipation is real. Okay. I'll see it when it pops up. Y'all, I'm doing okay. I have not talked on the phone. I took a picture. Oh, wow. Okay. Yeah, you have to be careful when you're diabetic and you take this surgery. You have to really be careful with this surgery just in general. But y'all, let me tell you, I get up every day. The first day I came home, the pain is awful. Um, the first day I came home, well, the day of surgery, I walked around the hospital. I got up, I did my little breathing thing because I was really afraid to get like pneumonia, and I didn't want blood clots or anything. Um, because that's a realization when you have surgery. So I was actually up walking after they got my pain under control. I was up walking. I was doing my breathing little machine thing, to kind of helps your lungs expand so that you don't get pneumonia. But when we got home, y'all, that ride home, they gave me some good shit in the IV because my husband drove me home. We had a pill in the car. We let the seat back, but like I felt every bump. Luckily, I was high. I've been so high, y'all. I don't know how people be like Molly Percocet. Like if you taking Molly and Percocet, you are so dumb because I've been out of my mind. Uh, I don't really like to take a lot of medication, and you really need the Percocet. Okay, you need all the Percocets in its glory. But every day when my husband gets home, he takes me to the gym, and I walk around inside the gym so that I don't sweat, get like real sweaty. But you definitely have to get up and move. Some days are really painful, some days are not, but you have to remember when it's time to take your medicine, like you need to take your pain medicine because I don't give a damn how big of a G you are. When that pain hits your titty and your nipples start thumping, girl, 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 it is not your friend, okay? So, like, it's coming up on, it's 5 o'clock. At 5:15, I'm gonna pop a perk because I need it to coincide with the Tylenol and stuff that I'm coming down off because I'm already starting to feel a little pain. And I'll take it. It'll start to work in about 20 to 25 minutes. I'll put my husband to get me dressed and then I'll go to the gym and walk around. But y'all, the pain. Oh my God. Hey, the pain is so real. Like, I thought that something was wrong the other day, so I called. I thought something was wrong on Sunday, okay? So, Redbird, you must be my spirit animal, my spirit friend. Because Redbird sent me a message on Instagram and she was like, "Are you okay?" And I didn't tell nobody that I had her surgery yet. So, I was like, yeah, I kind of like texted crazy because I didn't want to throw up any alarms, but I actually had surgery on Wednesday. But y'all, today is Monday. Today is not Monday. Today is Tuesday. This has been, let's see, Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday. It's been however many days it is, y'all, has been the longest days of my life. The fucking constipation was awful. Y'all, I was drinking, like, they gave me a stool softener. That stool softener didn't do nothing. It was like 3 days out, and I still, 6 days. Thank you, honey, because I can't even count the days. They gave me a damn stool softener. It didn't work. So, y'all, I was drinking Miller Lacs and black coffee to shit. And, y'all, I'm telling you, I had toilet triplets and my stomach is like my stomach is still bloated. Like I look prego. Um, it was just I don't like a lot of stuff on my chest, so that's why I got bottoms on. But y'all, when I went to the bathroom, that pressure of that relief, thanks, honey, made me feel so much better because I felt like it was in my chest, like my back was starting to hurt. I was so constipated. But thank you, Lord, for Miralax and black coffee. Because I was about to straight go. I was about to go the suppository route because I was so constipated. But y'all, I hope it. I hope I heal quickly, y'all. Like if you move around too much, like some people on YouTube, I think they be lying because they don't want to give their doctors a bad review. But your pain level has nothing to do with your doctor. Okay, let me make that clear. The amount of pain that you are in has absolutely nothing to do with your doctor. People just need to be real honest about things. I had a breast reduction. Y'all, if I could show y'all my nipples, I would. You can't even tell that this man moved my whole nipple. My nipples are fantastic. Ah! I shouldn't have screamed. Ouch. 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 Thug tear. Ouch. Um, y'all, my boobs are starting to get soft. They were so hard. Like, they were so hard. Like, y'all, look at that. Look at that little bit of cleavage. I've been drinking something to help me go, and a lot of water. But y'all, my breasts look so they so happy now. Like I have like the tape covering and the gauze. But y'all, they are so like I'm happy I had the breast reduction, but what people don't talk about is like you get depressed. Um I was a 39 between a 39 and a 40 H, I think. I was between an H and a G. Y'all, the pain. And then when you like some people say they don't have nipple sensation when they first get theirs done. And I don't necessarily think that's a bad thing. Because my nipples are very sensitive right now. I have to like I can take the pad out of my bra for my nipples, but because they're so sensitive, they like bloop 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 bloop. So that's why I'm still keeping the pads. I'm praying for a speedy recovery too, honey, because you know I like being on my back, but for different reasons. And since that's not happening, I'm tired of being on my back. Um, what X-nay, y'all forget I said that. God forgive me. I'm a dirty old lady. But other than that, I'm back to having like normal bowel movements. And I'm gonna be honest with y'all, you be in so much pain the first 2 days, you don't care if you take a shit the first 2 or 3 days because first of all, you probably can't get your hands back there to wipe your ass. So the constipation is not necessarily the constipation is not necessarily a bad thing because first of all, you can't reach your asshole anyway. And just trying to wash your vagina after you pee, y'all, I'm okay. The pain is a part of the process. I can lift my arms and move my arms around now, which I can't. Oh my god, look how tiny my arms are, y'all. But like, y'all, God, the pain. Like, don't be upset. Yeah, because it hurts. It's very uncomfortable. Thank you, honey. But y'all, the constipation. I wasn't after I realized that you can't really wash your own ass. Um, I wasn't necessarily mad about the constipation, but right as the constipation was letting go and giving me back my soul in my life, I could really reach around and wash my own ass. X-nay, I don't know why I'm telling y'all that. And y'all, the first day I had a bowel movement, it happened like 3 times. Like I had 3 big bowel movements. Cause I'm the type of person, TMI, TMI. I usually have a bowel movement 3 to 4 times a day. I am a very movable person. Okay. So like for somebody like me not to have a bowel movement for 3 days, almost three going on 4 days is not good because I have 3 to 4 bowel movements a day. So I still don't think I'm all the way cleaned out. So definitely when I hit my 3 week mark, I'm gonna start back on the cleanse, the apple cider vinegar cleanse, and doing smoothies. And I'm going to start like juicing 1 meal a day because I need to clean my system out, especially with all that medication. But I'm gonna wait until I'm about 3 weeks, 3 or 4 weeks post op before I do that. But y'all, people don't tell the truth. They try to make it seem all glamorous and stuff. That is a lie. There is nothing glamorous about getting a breast reduction. Maybe it's different getting breast implants, but my boobs look like implants. So look how round it is at the top, y'all. Look at This doctor sculpted my boob. Oops, snip slip. This doctor, I'm trying not to show my nipple, y'all. He sculpted my boob, y'all. Like, that boob is sculpted. Like, look at that. I already have. Most people say they don't see shape for 2 or 3 weeks. Honey, he laid the hands of sweet baby Jesus on my tit, okay? But yeah, so he did a really good job. Like it's got curve on the side. Ooh, excuse me, y'all. Um, but yeah, he really just took care of it. It's round, it's perfect. Um, I have like I don't know, y'all. He made me feel good about these painful tits. Yeah, cause some people, when I first seen some people's breast reductions, like they looked awful. He did a damn good job. Like I know people drive across the country for like breast reductions and stuff and go stay in a hotel or recovery house. I don't know if he do all of that, but y'all, like if your insurance will pay for Dr. Justin Martin, you need to go see him in his beautiful ass hands, okay? Because he a very unpleasant. This thing is, yeah, he did a really good job. Getting a breast reduction is not pleasant at all, but he made it as pleasant as possible. He checked on me after surgery. He checked on me the morning before surgery, the morning after surgery. He talked to me before I went in. You know, I had some concerns about not being able to breastfeed in the future because of it's different techniques that they use, and we thought that they were gonna have to take my nipple off and graft it that way. I wouldn't be able to breastfeed, and I was really concerned about that. But I told him to do whatever he thought was best for health reasons, because I didn't want to risk losing my nipples completely. And he took his time and he talked to me. He gave me all my options. And he just said, you know, I know you talked about it, we prayed about it, whatever, whatever. And he said, well, I'm just going to see because I want you to be satisfied. He said, if it's viable, we can do the procedures to save it to where you can breastfeed, then I will do it. If it starts to look like that it's going to be an issue, I won't do it. And I just left it up to him because they know best. And I really did trust my surgeon. I did a lot of research on him. He was one of the doctors that the TRICARE put on there, but really they just need to send all their clients to him. Um, because y'all, he finessed the nipple, okay? He finessed my tits. And the hospital stay, y'all, I gotta give a big shout outs to Flowers Hospital over in Dolton. The nursing staff, like, they were so nice. They took care of me really well. They made sure I had everything I need. It was like 1 o'clock in the morning, and you know most nurses they ain't trying to put you at 1 o'clock in the morning. But the nurse, whenever I wanted to get up and walk around, she got up and she walked with me. She talked to me. They were not understaffed. They had enough staff. The CNA was really good. She helped me go to the bathroom. She got me cleaned up. You know, they really took their time. They talked to me. Um, you know, they said I was a good patient because I followed the doctor's orders. But I feel like even if I was the worst patient, I still got good customer service. But like the hospital, Flowers Hospital is a really small hospital, y'all. But like the level of care that they give you, like it's clean, it doesn't smell like you know how a hospital just smells awful. Like it just has that sterile dead smell. And it smelled like they smelled clean and warm and the service was good. The breakfast was bomb. Like I was like, dang, do I have to leave before lunch? But the breakfast was bomb. They gave me grits, eggs, bacon with a biscuit. I couldn't really eat that much, but y'all like, and then at night she was like, "Well, if you hungry, we keep soup and sandwich in the refrigerator." I'm like, after the cafeteria closed, y'all keep soup and sandwiches and stuff, but y'all they had me a ginger ale. I felt like this is how the bougie people live in the hospital. But the hospital stay overall was just very delightful. The nurses were delightful. Y'all, that pain was not delightful. And I'm gonna tell y'all the story about how I woke up. We gonna do a story time about how I woke up because y'all, I was like, take me now. Because I was really scared, like the anesthesia, like the night before. Yeah, they were attentive to my needs. I think they're just a really good hospital. I just think overall the hospital, like, okay, I'm gonna say this, like, I've been some places in this country where I wouldn't let a doctor touch me. And then I went to places where I did and they misdiagnosed me, like with my AIF with my hip. They wouldn't even take an x-ray. They didn't do anything. They didn't try to help me when I was in Kansas or nothing. I was just in pain all the time. And then when I got here and it started acting up again, it got really bad. If they would have sent me to like real physical therapy and really helped me and really diagnosed me the right way, then I probably wouldn't have had as many problems with my hip as I did. Um, um, it's just a lot of stuff that they didn't do. That when I got here and I was able to get it taken care of, a lot of problems had been exacerbated because I didn't get the right medical care in Kansas. They just didn't care. They didn't want to touch me, and I know it was because I was black, and I really had like a really hard time. All they wanted to do was recommend me to go to medical studies, and that's just wrong. So I was really leery about medical care here, but I was happy to be home in Alabama. People can say what they want to say about Alabama, but Alabama is nowhere near as racist as people out in the Midwest in certain parts of Kansas. And I'm happy to be home in Alabama. I will definitely say that. Like, we have our flaws in this state, but I've always received top of the line medical care from every doctor I've had in the state of Alabama. It didn't matter if I was black or whatever. They were black, white, Hispanic, Asian. People take care of you down here when you get sick. Because if they don't, they won't be in business long. I tell you that much. The boards don't play here about stuff like that. But all the doctors I've had here, from like Dr. Martin, my dentist, my primary care, my therapist, I've gotten like the best care. So I'm just gonna put that out there. But the pain, the pain is real. Like right now, my nipple is doing something real weird. It's jumping, and it's time for me to take my crack. But the overall, I look rough. But I'm feeling a lot better. Like the sides of my boots have gone down. I can actually put my arms down on all the way down, flush to my side, when my sides are not swollen. But like, he did a phenomenal job. Um, and I'm gonna do a couple story times about it. The only thing I've been like worried about, I'm not worried about the scars because like the scars are now, that virtually the only ones that are really like, I, are the ones under my breast, but that's for everybody. But I still don't see them as really being a problem because you can't even see where he stitched it at. Like, you can't see it. I don't know what he did, but he got golden fingers, y'all. But yeah, I feel good. I'm just the pain. No, I had a breast reduction, but it just, I feel really good. Um, but the doctor I use, he does specialize in breast reconstructive surgery for breast cancer patients. So I think that's what makes him really good at like breast reductions and breast augmentations, because that's nothing compared to having to reconstruct a woman's whole chest after breast cancer. Um, if I ever have to have anything else done to my boobs, I don't give a damn where I am in the country. I'll definitely be back. I'm gonna do a video talking about my doctor more in depth. If you have to travel to get a good doctor, I would say he is definitely the doctor to travel for, because I called them on Sunday because I was a little nervous about my nipples. And you do, like, people don't talk about the discharge you have, and not all discharge is bad after surgery. But I did get a little worried because I had my surgery on Wednesday, and Thursday morning they took my drains out. because they said it wasn't a lot of fluid in there. So I was kind of nervous about that because, like, you have to prepare your body for surgery. And I did a good job. Like, the doctors are going to do their job if they're good doctors, but you also have to do your job. All right, honey, because I'm finna get off here because I got to get my medicine and get ready for the gym. But you have to do your part on preparing for surgery. But, yeah, let me get off here. I'm going to get myself dressed. And my husband's gonna help me get dressed, and I'm gonna take my pain medicine, and I'm gonna go for my walk, and then I'm gonna have my dinner, and then get cleaned all up and stuff, and then I'm going back to bed. Thank you. But y'all have a good day. And as soon as I'm really up and able to do a lot more, I'll be back. I'll keep y'all updated. I love y'all too. Y'all take care.